Hey students, it's Dr. Ways, and welcome to your lecture on the joints of the skull. Alright, we saw when we did the bones of the skull that there are different parts. When we looked at that exploded model, we saw that there are many different parts of the skull, and we looked at individual bones and saw where they are located, and each one of them is held together by a suture. However, we're only going to be responsible in this class for the primary sutures, what they look like in early development, and how they fit the bones together. So just a reminder that sutures are fibrous joints. They are synarthrotic, which means they don't move at all. So none of the sutures in the skull should move. And their job is to basically stitch the bones together. All right, so the main ones, and we kind of already went over these, are your coronal suture, which runs along the coronal plane that connects the frontal bone to the parietal bones. All right, then we have the sagittal suture running right down the middle along the sagittal plane that connects the two parietal bones together. And then in the back, remember, we have this lambdoid suture that resembles a Greek letter lambda that connects the occipital bone to the parietal bones. All right, and then over on the side, looking at this picture, we have the squamous suture that is along the temporal bone, and it connects the temporal bone to the parietal bone and the sphenoid bone right here. So before these sutures became interlocked structures that are rigid and hold the bones together tightly, they were what we call fontanelles. All right, so separations between the bones, and the reason for this is so that during the birthing process, the bones of the skull can kind of slip over one another so the child can exit the birthing canal, and then over time they slowly spread back out and eventually close. So there are four fontanelles that you should be familiar with during childhood. One is the anterior fontanelle, all right, and you notice the anterior fontanelle is right here in the front at the junction between the the sagittal sutures and the coronal sutures, and that's often the soft spot we feel in babies, and that closes after about 2 years. So it takes about 2 years for that to close. That's also a really important diagnostic spot, because if you happen to see bulging in that area, that could mean an increase in intracranial pressure that you don't want to have. Or if you see kind of a sunken appearance there, that means there might be some fluid leakage or dehydration going on. So a very important one to know in children if you're going into pediatrics. Then we have the posterior fontanelle, and that's between the sagittal suture and the lambdoid suture. That closes at about 2 to 3 months in children. Going over here, we have two more fontanelles. The sphenoidal fontanelle, right here where the coronal suture and the squamous suture kind of come together. That is closes around 6 months. And then the mastoid fontanelle near the mastoid process, where the the lambdoid suture and the sphenoid suture kind of come together. That closes anywhere between 6 and 18 months. The movable joint of the skull, actually there's two because you have one on each side, are the temporomandibular joints. So the temporal bone, remember we had this mandibular fossa right here, mandibular, and here's the mandible right here, and the mandibular condyle right here that fits into the mandibular fossa, form the joint. Okay, so it's again the only movable joint in the skull. And notice the structure is you have this cartilage right here within the fossa. That's pretty standard, and they're going to have one on the mandibular condyle right here. And there's fluid in there, but then you have this extra articular disc right here, right? And that articular disc in there is a protective mechanism, because not only can our jaw go down and up, but it can protract and retract, and it's this articular disc that kind of allows that to happen without causing damage to the joint. And so if you take your jaw and you protrude it forward, what you've done is taken the condyle out of the mandibular fossa and moved it forward. So if you want to get a feel for this, have your jaw in a neutral position and go back and forth. Like move your jaw back and forth. Then protrude your jaw, protrude it forward, and do the same thing. And you're going to hear and feel bone against bone right there, because you have this mandibular condyle rubbing up against the anterior end of the joint. That protruding movement is primarily the result of contraction of the lateral pterygoid muscle. All right, contracting and moving the joint, or moving the joint in a forward direction. But when it's in place, it normally acts like a hinge, so the jaw will rock back and forth within the mandibular fossa, creating a hinge-like movement, opening and closing your mandible, or mouth, rather. All right, so like many other joints, we see these ligaments that are holding the joint in place and making sure that it doesn't come out of its capsule. And over to the right, we have the various movements of the joint. So we have elevation of the joint, which is closing of the mouth, depression of the joint, which is opening of the mouth, and these are the muscles that are responsible for that movement. Then we have the protrusion, where we protrude the joint out in front of us, and then retraction is bringing it back. But we also know that we can move our joint from side to side as well. So why that's not here, I'm not sure, but you're able to move it from side to side as well. And that side to side movement is achieved by contracting the lateral pterygoid as well.